Hello and welcome to another edition of Professor Speaks. For our topic today, we're going to talk about what happens when no one will take responsibility for a patient's care or treatment. But before we get into that, I would like to remind you to hit subscribe and hit the little bell for notifications. Hello and welcome back to Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And we're going to get into more coordination of care. So coordination of care is one of the reports that we do here at Pharma. But we want to explain to the viewer what it is coordination of care actually is.
Yeah, I guess fundamentally the question is, suppose that you are seeing multiple specialists and a primary care physician, or you've just been sent to one specialist and you are trying to understand what that specialist is doing,
right? But
you're not getting a reasonable answer. Clearly you want someone to follow what's going on. So the primary care physician is kind of following all the specialists. Perhaps there's a nurse or a nursing organization that is following to make sure that your care is being coordinated between home, doctor, if you go to a facility or otherwise, how that is being followed. So it's multiple entities trying to make sure that one group talks to another.
Right. So when you're looking at coordination of care, you know that it involves multiple entities. Most of the time, it's different facilities involved. So you want to make sure that they talk to each other. Like, as you said, who usually takes responsibility for that kind of?
Well, ultimately, the primary care physician is the one who is kind of the originally under managed care was the gatekeeper, but also as a function is sending you out to specialists or is trying to get information from specialists so that they've got a complete view of what's going on with you. Okay. So in that particular regard, you're hoping that all of the specialists are talking to the primary care doctor, and then separately, if the patient is moving between several different centers, then clearly a nurse or a nurse group would help follow you. All of this, let me just back up for a minute so we all understand. Healthcare has gone from being a silo program where doctors are in one silo, specialists are in another silo, pharmacy, hospital, nursing programs are all in different silos. Okay. And the problem has been they don't talk to each other. Over time, as managed care came in and now population health came in, it was supposed to be that the primary care physician would be kind of the chief of the team, would make sure that everybody knew what was going on and that the patient was made aware of what was happening, why one specialist was doing one thing, another specialist was doing something else. And that as some nursing team was looking to find out those people who were showing up in the ER all the time, why, what was going on, and could there be a way to keep them out of the emergency room, what was happening if they were going for multiple tests, and did they know, and were they showing up on time, etc. So the idea is to break down those silos and to try and make sure that everybody communicates. Clearly,
integrate everybody.
And clearly with iPhones and all the rest of the things that we have today, there's the issue of trying to bring that all together so that ultimately the patient knows what's going on to themselves because they are now part of the process and a communicator, but also that all the doctors know what's going on with the process.
Right, and that's where we get into the main reason we broached this topic today was what happens when no one will take responsibility for a patient's care or treatment.
Yeah.
So as you've heard Dr. Stern say, there's coordination of care is when you try to integrate primary care physicians, nurses with the specialists so that everybody knows what's going on with the patient's care.
Right.
So as you can imagine, there oftentimes, sadly to say, there's a breakdown between primary care physician and the specialist or even a nurse in that matter. And
yes. Dr.
Stern has had it happen to family members and friends of his, and I've had it happen, and it's a sad topic to kind of broach if you really think about it. But there's got to be a way to kind of bring it all together. Like, how does this breakdown actually occur?
Well, it's actually several different stakeholders, several different people that are supposed to do things, and for whatever reason it doesn't quite work out.
Uh-huh.
Either because they are not doing it or because they think it's happening,
Right.
but it's not happening. It's kind of like communication. I talk to you, and hopefully you understand what I'm saying, and hopefully you say to me, I don't understand what you're saying, explain it to me, which you do all the time, right? Right?
Well, yeah, I should do
it more. Or you say to me, or I say to you, or whatever.
Yeah.
But at the end of the day, the patient ultimately needs to understand what's going on with their care.
Right.
And if they go to one specialist, and one specialist is doing something, and another specialist is doing something else, they need somebody to interpret for them, to tell them what's happening, why. Is this really important? Is it just management of testing and things that they're doing in order to know what's going on? Right. The doctor, on the other hand, has a responsibility as well. They need to make sure that if they're a specialist, they're a cardiologist or a gastroenterologist or oncologist or whatever, that they're talking to the primary care doctor and telling them, this is what's going on, this is why, this is what I think is important. And then as a team, everybody's talking about what to do, but the cardiologist can't go off and just do something without telling anybody, nor can the urologist or the oncologist or the individual who's taking care of rheumatic disease, arthritis, stuff like that. They can't just go off and do things. If they do and no one understands it, then there isn't any coordination of what's going on. The patient is left without understanding, the primary care doctor is left without understanding, and everybody's kind of working on their own individually. So which chaos, historically, yeah. It is chaos. It's historically what happened, and now over the years, it's to try and integrate all of that to make it clear what goes on. That is also the reason why many healthcare groups, Kaiser certainly has it, so does Group Health, so do issues with Harvard Health Plan and others, where they have nursing teams that are following these patients and then feeding that information back to the primary care,
right,
and potentially to the specialist, so that there's a group of nurses who are watching to see, why is this patient showing up for these tests all the time? Why are they coming in for dialysis all of the time if they're not a end-stage renal disease type of patient? Why is this happening? Why are they coming for testing? And maybe it's duplicative testing. One physician has ordered one test, another physician has ordered another test, and they're the same test. And they're trying to make sure that you don't duplicate all of those functions. So everybody in the process needs to know what's going on. It's kind of a team. Primary care as the coach, with each of the other individuals talking to the coach and telling them what they're doing, and the patient talking to all of them, trying to understand what's happening to them.
Right. You can see that was a fairly complicated web,
Thank
you. It is manageable, and we've seen primary care physicians be able to manage that kind of process.
Yeah.
But we could also see where the breakdown could occur. You mentioned several ways it could, but we also want to stress how important it is, because there are potentially fatal issues where this breakdown could be fatal, where you have a drug contraindication. Like one of the reports that we do, we test for those kind of contraindications between two different drugs. Like if one specialist is prescribing one drug and the other specialist is prescribing another drug, and then they could potentially be a fatal reaction to that.
They could.
Yeah.
Look, Pharma is involved in this, and I don't want to market that issue, but a lot of the stuff that we're doing is not unique in this regard. But I want to point out the fact that on one level, we're putting out reporting, so are others, that says to appropriate doctors, here's prescriptions, here's things that are being done by this doctor, here's things being done by this doctor, here's things being done by that doctor, so that this doctor knows what's going on. That's one thing. Second thing is to try and identify gaps in care where there are problems, like what you're talking about with regard to interactions, but it could be dosing. It could be that some doctor has given a patient a prescription for opiates that includes like hydrocodone and APAP, which is hydrocodone and opiate, and APAP, which is Tylenol, but they've given him too much Tylenol. So as a result of that, they're treating pain with the hydrocodone and getting whatever problems with that, and they've gone over the maximum doses of APAP and therefore caused liver disease. I've seen this kind of problem over and over and over. We see it with our reporting. We've seen it personally. We've seen it professionally. Our point is that these things happen if people are not paying attention and not enough people are asking questions. To every patient out there, ask until you understand what's going on.
Exactly.
And to every doctor out there, make sure that whatever you found, whatever you're doing, you're communicating to the team leader, to the primary care physician, so that everybody knows what's happening. And to the nurses that are doing it, make sure that all of this information is being fed to the team so that the team can make decisions about it. And finally, clearly pharmacy is heavily involved because over 80% of all therapy from an ambulatory side is drugs. And as a result of that, we need to make sure that that is being handled in an appropriate way. Everybody needs to talk to each other.
Yeah, and you mentioned, like, we've talked about in previous episodes about how pharmacists can get more involved.
Yes.
And they can ask these questions to their patients as well. I know you got a lot of pharmacy students out there that are probably watching this. You need to nah. But it's good for a pharmacist to actually ask a patient questions, meaning you're getting prescribed this. I also see that you also got this, right? They can see that kind of profile.
Well, the fear here is the following. In the prescription, there's no diagnosis. So technically, the pharmacist doesn't know why someone is taking the drug. They can impute it. They can see a drug for high blood pressure, diabetes, or whatever, and assume that the patient has these diagnoses.
Right.
But the second issue that they have is the fear that they're going to say something that the doctor didn't want anyone to know, and so that it was to be kept a secret. The real problem with that is that secrecy leads to everyone not knowing what's going on.
Exactly.
And as a result of that, problems occur. So once again, the patient should be asking the pharmacist questions. They should be asking their primary care, all their specialist questions. Everybody should be talking about what's going on here so that the team leader and the team can coordinate care. That's what has to happen.
Just out of my own curiosity, are there any scenarios where a doctor would actually keep a secret from a patient?
Yes, and it's questionable. I don't think we can get into that as to why or otherwise. In general, if the patient says to the doctor, I don't want to know, then clearly they wouldn't tell them. In most cases today, is the kind of the profession has morphed and gone from primary care, managed care, population health, where everybody has a phone and can keep all their information together.
Right.
Now it's really hard to keep a secret, and more important, it may be a secret that is really going to harm somebody. So in today's world, the idea that you're doing it is less and less where somebody should know what's going on.
Right.
Clearly, there are patients, I've seen them too, who are afraid of any information. So you want to help them, but you have to be cautious, because if you give them too much information, all of a sudden they take it to the extreme and they think that somehow, they're going to die of a particular condition or otherwise, and all you want to do is to try and treat them. But every patient is different. Everyone has to be addressed. But in a general way, irregardless of whether you think somebody's keeping a secret or not keeping a secret, in a general way, everyone needs to know what's going on, because if you don't, then the complications and the problems occur. That's what needs to be something we don't want.
Right. I didn't mean to put you on the spot.
It's okay. You can put me on the spot. Anytime.
All right. I'll remember that.
Thank you.
And click this on there. So for my last question, I just wanted to make sure that we get this information out there, but also what should the patient do in order to avoid these coordination of care issues that they may not even be aware of?
Well, number one, the patient themselves should identify who their primary care physician is. If they don't have one, get one.
Yes.
And make sure that they have good communication with that physician as to what's happening, what are you doing, why are you doing it, etc. What am I supposed to expect?
And also, when you're selecting your primary care physician, a lot of these there's a lot of these insurers that have kind of a rating system. I've seen it before.
Some of them do that, yeah.
Where patients will talk about this doctor being so great, or patients will talk about this doctor might have a little communication issues, but you could choose between what primary care physician you'll have, and you'll be more comfortable choosing, knowing and visiting this doctor.
Yeah. The only follow-up to what you're saying, you're absolutely right, is that they have lists of people and you can choose them based on whatever you want.
Right.
But the other part of it is that if you're referred or you go see a specialist, you need to question them as to what's going on, and then tell them, my primary care physician is Dr. X. You need to send that information so that my doctor knows everything that's going on with me, so that they can coordinate what's going on. That is incredibly important.
And especially therapists as well.
Therapists,
psychiatrists, and all that.
Everybody. Psychiatrists, physical therapists, chiropractors, specialists in any medical subspecialty, anybody that is taking care of you. You need to make sure they know who's my primary care physician, and then ask them questions. Why is this going on? If they refrain and they don't want to tell you because you had an EKG or an X-ray, and they don't want to read and give you some statement that'll be contrary to the physician, then you need to know. They need to know, this is my primary care physician. When are the results going to be made available? Who do I talk to? I want to know what happened.
Right, so it's incredibly important that you pick a primary care physician that's right for you. You've seen this person, so you know you're comfortable with that person or that doctor. And then once you see your specialist, whether it be chiropractor, psychiatrist, whatever it is, that they send all your information to your primary care physician, so that your primary care always knows everything that's going on.
Yep. Absolutely. Absolutely.
All right, that's all we have for today. Thank you very much, Dr. Stern.
Thank you.
Make sure you go visit ProPharmaConsultants.com. We have a free information page called RxInfoX. Make sure you like, comment, share with a friend, and remember to hit the subscribe button. And we'll see you next week.